So JP just went through how PDI starts. PDI always starts with an effective command. And so then the question is, what happens after the parent gives a command? And the PDI procedure that I'm going to go through takes, again, is like timeout on steroids. That's actually, reused that same phrase, so I think it really speaks to how true it is. And so we'll go through that procedure now. I will tell you, and somebody mentioned yesterday, that most of your parents are going to come to you having tried timeout before. And most of them did not have a successful experience. So it's important to talk with them about it before you go through the steps. Say, have you tried timeout before? How was it for you? And ask them those questions and really listen. Because timeout is actually much more difficult than you think it's going to be, especially when you're working with really active, persistent, oppositional kids, right? So it's not to say they didn't do it correctly, but oftentimes kids kind of find that loophole that made it really challenging. So ask your parents and listen to what they say. Yeah, I really tried, but every time I put her on the chair, she jumped off, and so I finally just gave up, right? And that's really challenging. And so let them know that you understand where they're coming from, and that that's one of the beauties of PCIT, that Dr. Iberg took the timeout procedure and she closed all the loopholes. So just talking with parents about that first. So JP went through kind of what makes an effective command. So if the parent is going to give an explanation, they do it before the command. If they give a command, let's say it is, please sit in the chair, and the child does it, what do you think that we do? Labeled praise. And what kind of behavior do we want to especially praise? Sitting in the chair. What did the child just do?
Follow directions.
Follow directions. I love it when you listen, because that's really what we want to jump on, the compliance, right? So nice big label praise. Also, if they want to give that explanation at that point, that's okay. Thank you so much for listening. Now it's our special time, right? That's a great time for the explanation as well. Now, we are working with oppositional kids though. Please sit in the chair. We have to give the kid an opportunity to do it. We don't expect kids to immediately just jump right to it. So that's where we have the 5-second rule. We actually have the 5-second rule for both as well, if a kid doesn't immediately do something. So the parent is taught to count silently in their head, not out loud, to 5. Please sit in the chair. 1, 2, 3, 4, 5, in the head. Why do you think we do silently? It's distracting, right? And how many people have seen the 1, don't make me get to 2, don't make me, I am at 2. Melanie, I am at 2, you don't want to see what happens at 4, right? It becomes this really stressful interaction in and of itself, right? And every time the parent counts, it's almost like they're saying out loud, it's almost like they're saying, no, listen now. So we eliminate that. So count silently in their head. Now, if they do it within the 5-second window, they get their nice big label praise. Right? They don't have to do it on second 1. However, they also have to do it within a reasonable time frame. What we're teaching kids to do is to listen fairly quickly and be responsive to their parents' commands. So if they are meandering over and they sit on the chair at second 5, they made it. But if they take a full 10 seconds, that is a disobey. Right? And so at the 5-second mark, if you haven't had compliance in that, or at least the child's not at least trying to comply, then they get the timeout chair warning. And we are really nitpicky about the wording of the warning. Okay? We teach parents that we really do want them to use these exact same words every time. If you don't, whatever the original command was, so in this instance, it would be, if you don't sit on the chair, this is a little bit of an odd example, if you don't sit on the chair, you'll have to sit on the timeout chair. But that would work, right? And we are nitpicky about the words because it's that consistency piece. We want the parents to learn to do the same exact procedure, the same exact way every single time. It's really helpful for the child in their learning, and it's really helpful for the parents. Discipline is stressful, and especially when you're attempting to discipline your child and they're not listening to you. And so what we want parents to do is we want them to learn these words and have it just like down pat, like a script. And they don't have to think about what to say, and they don't have to think, well, what if the child does this? We use the exact same words every time, so in the heat of the moment, they can just pull out those words and they don't have to worry about it. So we are pretty nitpicky about it. The other nice thing, do you guys notice about the wording here, is that the command is purposefully embedded in the warning, and that is done very purposefully. Because let's say I have an ADHD kid, and they're like, what, mommy? What chair? What, mommy? We've already talked about the fact that we don't really want to engage in explanations at this point. John Paul, I said this chair. No, this one over here. We don't want to get into that, but the warning, if the child really didn't hear, the warning is an opportunity for them to get it again. If you don't sit in this chair, you'll have to go to the timeout chair. Okay, so that's done very purposefully. Now, what do you think? If they obey the warning, should we give them a label praise?
Yes.
Yeah, because everybody deserves a second chance, right? And maybe the kid really didn't hear. So absolutely, thank you so much for listening. And if the parent wants to, they can provide an explanation at that point and go back to play. But these are oppositional kids. Sometimes they do not listen. So if they don't, they've had the command 5 seconds. After the warning, they also get 5 seconds. So the parent is taught to count silently in their head to 5. And if at that 5-second mark after the warning, they haven't complied or at least started to try to comply, then they go to the chair. And again, bum, bum, bum. Again, we're pretty picky about the wording. And the wording is, you didn't do what I told you to do, so you have to sit on the timeout chair. At that point, what do you think most kids do? Thinking about your oppositional kids. No, I'm not going. You can't make me. Okay, mommy, I'll sit on the chair now. I'll sit on the chair now. I just had to do something first. Right? The negotiation sometimes happens. The I'm not going to go sometimes happens. The I didn't hear that. I'm continuing to play sometimes happens. It's very rare in the beginning that kids just happily say, okay, I'm going to go sit on the timeout chair, right? So the parent does have to get the child to go, right? We tell parents we do have to bring them to the chair, but you do so with the minimal assistance necessary. A lot of kids will go with simply a hand on the shoulder, right? Just kind of guiding them. A lot of kids will do that. Sometimes, in the beginning, especially of PDI, then the kid might kind of, drop to the floor. It might become kind of a chase scenario where they're climbing under the table, and the parent does have to physically get them to the chair. But remember, you are there coaching the parent through. And I think it's actually really helpful for parents. We can talk to them about the safest and quickest way to get them to the chair. The safest way is to scoop the child up from underneath the armpits. You don't want to be pulling at little shoulders or anything like that, with the kiddo's arms and legs facing out. So the kid can be trying to kick or hit, but they're basically hitting and kicking air. So that is necessary if the child resists the timeout chair, but if the parent is consistent and brings the child to the chair every time, pretty quickly those types of behaviors go down as the child learns, you know what, you're going to go to the chair no matter what. It's just a matter of how difficult you want to make it on yourself. So that actually is not necessary as often as people might think. Now, let's say, coach the parent, put the child on the chair, back away, and say, stay here until I say you can get off. And the parent walks away and goes to the table, and what do you think they do at that point? Oh, good point. The child might get up. That is a very good question. We're gonna table that one for later. Very good question. What do you think as a coach, a PCIT coach, you're gonna coach your parent to do at that point? Kiddos in timeout. Ignore. Yes. This is where their good ignoring skills that they learn in CDI are so important. So you're gonna coach that parent. As long as the child is on the chair, you are going to ignore everything. And I mean everything. And I have seen everything from the child, because the child at that point is going to try their best to get the parent's attention. They're on the timeout chair. Parent is coached to walk away, go to the table, and start playing and having fun. Kiddo does not like that. Right? Timeout is effective because it is a removal from the parent's attention and any opportunity to earn their parent's attention. So it's your job as a coach to be keeping that parent in the ignore. And you say whatever you need to say to keep that ignore out, because that's what makes timeout effective. But again, remember, these are very clever little guys, right? So they are going to pull everything out of their head they can that might get the parent to respond. So we call it the scrolling child, though. It's really it's almost kind of funny sometimes when you really take a step back and listen. It's like, I love you so much. I just really want to play with you. I'll do whatever you want. The parent ignores. So then like 10 seconds later, I hate you. I hate you. I like Daddy so much better than you. You're stupid toys. Like, And you can point that out to the parent. Use humor. And be like, so 2 seconds ago she loved you. Now she hates you. I think we know what's going on here, right? So really, again, but it's your job to point that out to the parent to help support them through. Sometimes parents have a hard time. Now this is, again, let's take a step back and realize what we're asking parents to do. Their kid is screaming their head off and calling them a bad parent and threatening to call DSS in front of a trained professional in this kind of stage situation. It's really hard, and sometimes parents get a little distressed. But again, that's your job, to keep them calm. Normalize, normalize, normalize. This is normal. This is actually kind of good, because this shows that he's testing the limits. And I am so glad that I am here with you, supporting you through this. I see what it must be like for you when you were trying to do timeout at home. I'm so glad I'm seeing this and I'm here with you. And don't worry, I've seen everything. You know what? That's why we have Lysol. It's fine. I'll take care of it later. Right? So whatever you're presented with, normalize, normalize, normalize. And reframe it for the parent. He's yelling because he really wants your attention. She doesn't like being away from you and away from the fun play with you. That's a lot more of a positive thought than my child is screaming because she's really just trying to irritate me and she's trying to embarrass me in front of the therapist. Right? So it's your job again to reframe all of that. So the child stays on the chair for 3 minutes plus 5 seconds of quiet at the end of the 3 minutes. So the 3 minutes is our base rate. That's what we find is an effective punishment, long enough to be effective punishment without being overly long. You hear some parents say, well, they had to sit on the chair for 2 hours. It's like, whoa. Talk about developmental appropriateness, right? So 3 minutes, but they do have to have the last 5 seconds of quiet. So we can't just say straight 3 minutes. Remember, kiddo, we're ignoring. Let's say, though, we just did straight 3 minutes, and we're ignoring everything, and kid's having a temper tantrum, and at the end of the 3 minutes, they scream, I hate you so much. And the parent gets up and says, hey, you're sitting quietly, and ends the timeout there. Then what has the child accidentally learned? If the parent responds and ends timeout right as the child screams, I hate you. They're being reinforced for saying, I hate you. Yeah, it's accidental learning, but it's still very powerful. So then guarantee you, what's the kid going to do next time he's on timeout? Scream, I hate you, because it worked the last time, right? So we wait for 5 seconds of quiet at the end. Now, if the child is quiet for the last minute, you don't have to wait an extra 5 seconds, you just the 3 minutes. But it can prolong your timeout somewhat because you're waiting for 5 seconds.
What do you do with a child who's crying all 3 minutes?
Ignore. And then you do have to wait for 5 seconds of quiet at the end. Yeah. So it can go longer.
4 minutes go by, 5 minutes. So you're waiting until they open.
Yeah. Yes. And I know what you guys are thinking. Yes, it can make timeout fairly long in the beginning. Again, quickly the child will learn And you'll see the way the procedure is structured. It's really structured for the child's learning. And for the child to learn, actually, it's just a lot easier for everybody if I just listen on the first time. And I'm actually going to, that is a really good question, but I'm going to actually ask you guys to hold your questions to the end just because PDI tends to bring up a lot of questions, and I want to make sure that I get through the procedure and you guys see the flow of it before we get into that, because again, I can get very distracted because they're all really good questions. But jot them down because they're good. So, ignoring, waiting for 5 seconds. Once you get that 5 seconds, you coach parent, walk on over, say you're sitting quietly. Are you ready to sit in your chair? Right, so, this is key. Timeout is not a way out of complying. The child has to agree to be ready to comply with that command before they can get out of timeout. And that's a difference. It's a subtle difference, but it's a very important difference from our timeout from many other timeouts. Because there are a lot of things that kids would rather sit in timeout than do what their parent told them to do. So they're like, oh, I'll sit my timeout, and then when timeout's over, I'm out of it. No. This is structured so that the child learns it's just easier for you to mind the first time, for you to listen the first time. So if the child indicates yes, then the parent guides them over to the table or to wherever the original command is. We judge yes on either verbal behavior or motor behavior. So the child might say, yeah, and then the parent can just kind of guide them. They might just jump up and do it. That's fine too. We don't need a yes. Okay? So let's say it's been 3 minutes. You're sitting quietly. Are you ready to sit in your chair? Yes. Child goes, and they do it. Trick question. I'm going to prime you guys. This is a trick question. What do you think the parent does then? That is a very good response, but it's actually why it's a trick question. At this point, the parent just gives a brief acknowledgement rather than a label praise. Because think about how much we had to go through to get the child's bottom in that chair. That was a lot of work, right? So we don't want to reinforce that behavior. So at that point, the parent is coached just to give a brief acknowledgement, something like, okay, or that's fine, but actually avoiding a praise at that point. However, we're going to coach a follow-up command immediately after. So they might say, okay, now hand me a crayon right away. And at that point, the child is very likely to comply because they just went through timeout, been there, done that, not really keen to go back. So they often do it. And if they do it, then there is a huge, enthusiastic label praise. Thank you so much for listening. I love it when you do what I tell you to right away. We're so excited to play with you. So that, again, the child sees the very distinct difference between when they listen and when they don't. So we have that opportunity to really point that out for the child. Now, it is its own separate command. Most of the time, children listen to that follow-up command. But if they don't, then the parent is coached to go through the procedure the same way. Okay? So let's just go back. What if the child, you're sitting quietly, are you ready to sit in your chair? No. Or, again, we don't even have to get a no if it's a, that's probably a no, right? Or if it's, well, I tried to sit in the chair, but you wouldn't let me because you were being mean and listening to Miss Rhea. That's probably a no, right? So at that point, the parent says, okay, stay here until I say you can get off. They walk back to the table, and the whole 3 minutes starts again. Again, we require the child to comply with the original command before their timeout is over. And they can sit there, that's their choice, but they are going to stay in timeout until they agree to listen. Okay, so that's the procedure. However, we have to get back to this issue of what if they get off the chair? I said earlier that we ignore all of the child's behavior on the chair as long as they stay on the chair. What do we do if they don't? The first thing we have to discuss is how do we determine if the child is on or off the chair? Seems very straightforward, but remember, these are very clever little guys. So what you'll get is the I'm on the chair. That's why we have the 50% rule. Okay? Now, it's not exact math. I don't expect you to pull out a ruler. But it's a general guideline. So at least 50% of the child's body has to be on the chair. Okay? Usually it's pretty clear. So, you know, if they're on the chair but their legs are hanging over, that's fine. If they kind of are leaning to the side but most of their body's on the chair, that's fine. We actually include standing on the chair as on the chair because all of their body weight is on the chair. But if this is my timeout chair, this is not on the chair. Being underneath the timeout chair is not on the chair. But Mom, I'm in the space. So roughly 50% of their body has to be on the chair. Just for when the child leaves the timeout chair before the parent tells them to, we have a backup plan, and we use a timeout room. We're going to talk about what that looks like in a little bit, how you actually kind of structure that in your agency, things like that. But the idea here is that, remember what I said earlier, timeout is effective because it's a timeout from the parent's attention. The backup just has to be, theoretically, it just has to be a further removal from that attention. Okay? So it does not have to be a full formal room. It's just the idea that the child is just further removed from that parent attention. The first time the child gets off the chair, and they're told exactly what's going to happen before this happens, you explain it to them. And then the first time they get off, the child gets the timeout room warning. They get this warning once ever in their life. And the timeout room warning is, you got off the chair before I said you could. If you get off again, you'll have to go to the timeout room. The parent then brings the child back to the timeout chair and says, stay here until I say you can get off. Walks away. If the child then just pops right up, because they're like, yeah, you're not going to do that. Anytime they get off the chair after that warning, the parent is instructed to say, you got off the chair before I said you could, so you have to go to the timeout room. The parent guides the child to the room, and they are in the timeout room for 1 minute. It's not as long of a time. It doesn't have to be as long of a time. But we still have the same requirement for 5 seconds of silence. And we have it for the same exact reason. We don't want that child to think that any of their behavior got them out of the room. Okay? So you're waiting for the 5 seconds of silence, the 1 minute plus 5 seconds of silence. Once you have that, then the child is escorted back to the timeout chair. Stay here until I say you can get off. And then the whole 3 minutes starts again. And again, that's key, because the idea here is the child is very quickly learning. It's just easier. It's ultimately easier for you just to listen. But if you do have to go to the chair, it's easier for you to stay, because you're going to have to restart your timeout. Okay. Now, the timeout room, oftentimes people are like, really? You have this whole room? And how does that work? And how does that work for families? And we're going to talk about that. But honestly, if you are consistent with the procedure, for any one family, you don't have to use the timeout room very often. Because again, the child very quickly learns. It's a very clear procedure. It's easier for everybody if you just stay on the chair. Okay? So again, and from that point, again, everything follows the same. If you had to go to the room, after the 1 minute plus 5 seconds, they go back to the chair, stay here until I say you can get off. They stay for 3 minutes plus 5 seconds of quiet. You're sitting quietly in the chair. Are you ready now to sit in your chair? And the child, if they indicate yes, come back, say okay, and then go back with your original, another follow-up command, now hand me a crayon. So we have that backup procedure. So that's the procedure. And if you think about it, CDI has really provided parents with all of the skills they need for PDI. Right? So we've talked with them about label praises. which are so important in PDI. And it's really important that the parent is super, super comfortable with label praises, because we want the timing of PDI is critical. This is where it gets to that consistency, predictability, and follow-through. So we want parents to be, boom, in there with a label praise. Thank you so much for listening. I love it when you do what I ask. Right? So that's critical. And avoiding questions, so important when we think about effective commands, that they're very comfortable with those, not giving those question commands, or even, I mean, I think it comes through in a lot of different ways, that we're really teaching parents to be confident in this procedure and to be okay with setting limits. So, honey, are you okay? You're sitting really quietly in the chair. It's not the type of behavior we want the parents to do. We want them to be confident. And ignoring. Ignoring is crucial in PDI. And really, we mentioned it yesterday, timeout is actually just an extreme form of ignoring, really. And so parents really have to be comfortable with ignoring skills during PDI. And again, being prepared for the fact that kids in PDI will be testing quite a bit and be trying to get their parents' attention. So it's, again, critical that the parent is comfortable with that piece before you move on to PDI. Okay, so this whole issue of the timeout chair and timeout room, how does that really work? Okay. Again, we can be very creative with what the chair actually is and what you're going to use for your timeout room, as long as we keep certain things in mind. And of course, the number one thing is safety, that it needs to be safe for the child. And understanding that the child might be a little upset. So we talk with parents about a nice, sturdy chair. We don't use like kiddie chairs that they could easily just like jump on and break. We don't use rocking chairs because those are way too much fun and potentially could be dangerous as they're rocking back. We don't use swivel chairs. Again, too much fun. Even these chairs that you guys are sitting in, thank goodness you guys are so well behaved, because they're very flimsy and very easy to kind of knock over. So good sturdy chair. Oftentimes just a good kind of old school armchair, like those overstuffed armchairs are good. No distractions. Again, timeout is a timeout from positive attention and anything that could be positively reinforcing as well. So you don't want it to be fun. You don't want, this is where it's really important to talk with parents about where is your timeout room, timeout chair at home. You find out 3 weeks into PDI, parents are like, I don't know, she really seems to like timeout. I know this is crazy, but, and you're like, okay, well, let's talk through, where is the chair exactly? Yeah, it's right in our living room, which is great, because I can keep an eye on her. Okay, what's in your living room? Well, TV. Where's the chair? Exactly, in relation to the TV. Oh yeah, I guess it's kind of in front of the TV. Turns out she's been watching TV in timeout. She's gonna like timeout, yeah? Even things like, they're right in front of a window and there's a lot going on. You just want to think through what might end up being positively reinforcing for that child. Examples of a timeout room. Again, we don't expect parents to have timeout rooms. I have one family that just started PDI, and we have a very good relationship, I will say. And when I started talking about the timeout room, Mom looked at me and goes, I don't have a timeout room in my house. And I was like, oh, I didn't tell you about that? And she was like, what? And I was like, haha, just kidding. No, we don't expect parents to have a timeout room in their house. I plan on having one in mine, but that's maybe a little bit on the opposite extreme. So yeah, again, just keeping the theory in mind that the timeout room just has to be a further removal from the parent's attention. I actually more and more have been loving the parent bedroom as a good one, because I think about when I was a kid, I felt really bad for my parents. I thought their room was so boring. They had no Barbies. They had no poster of Jason Priestley. It was like so lame. And so I think that can actually be a really good one. And thinking about the fact, too, that what I said earlier, you often don't have to use the timeout room very often. It's usually just in the beginning as the child is learning the procedure and kind of testing the limits. And you the parent practices PDI in very prescribed times in the beginning. We slowly generalize to the home, so they know when they're going to potentially need the timeout room. So right before PDI practice, can we take mom's jewelry out? You know, right before, for a few weeks as we're generalizing PDI, can you kind of safety-proof the room? So parent bedroom, actually nowadays, they have these really hardcore secure baby gates now, where they like snap in, and I mean, you aren't getting through that. You don't want to use one of the flimsy ones, but if they kind of snap in, you can even just put the baby gate across the hall. That works. A laundry room can work. Just being careful with things like detergents. Obviously, those can have to be put up, but you can be really creative with what is actually a timeout room, just remembering the theory. And my center, we work with a really diverse population. We have some parents coming in, they have one-bedroom apartments. They look at me like, I do not have like a full empty room. But we're able to, once we walk through the space and think about it and just remember the theory, we're always able to find something. So it can feel a little overwhelming at first, but you can get there. And again, that this part of the procedure often can feel very unique to both parents and therapists, and parents might be a little nervous about it, but the form of this backup is essential, because a number one way that kids undermine timeout is by getting off the chair. So we need to be able to close that loophole. So you're like, okay, Rhea, that's great that you can problem solve with the parent, but I'm thinking about how I might implement this in my agency, and I know my boss will not let me have a full empty room. All right, so what are you going to do there? Remembering, too, though, that a timeout room is just a small space with nothing in it. We actually really recommend for agencies the concept of a Dutch door. Does everybody know what that is? Think Mr. Ed. Did I just date myself? Where he has the swinging door. It's where the top part of the door is removable and open. So that it's very clear that it's not, the kids can see out. This is not an extreme form of punishment. And so it can be actually oftentimes very easily built into your existing playroom. It's just, we have dimensions we can post. I think they're actually maybe available on PCIT International, but it's a fairly small space. Obviously, we don't want the kid to be crammed in, but it does not have to be large. And so that's what actually we've done at our centers. We've just built them into our existing space. And it's really, honestly, not that much money, because if you build it into a corner, it's a wall and a Dutch door, and that's it. So we encourage agencies to think about that, especially if PCIT is part of your long-term goal. But again, there are alternatives if you don't have a timeout room. Could you use an empty therapy room? Again, remembering that you are really going to know and be prepared for when you might need this. This is just for PDI sessions, and typically it's just for early PDI, again, as the child is testing. But if, you're in a crowded agency, you really have exhausted every option, it's just not feasible, and then there is an alternative procedure. It is empirically supported. It's called the swoop and go. Very descriptive name, because basically, if you don't have a timeout room in your clinic, what the parent will do is they will say, you got off the chair before I said you could, so I'm going to take the toys and leave the room. And then you have to have kind of a laundry basket or some sort of basket in your space, and the parent literally swoops the toys in the basket and leaves the room. So in essence, the playroom becomes the timeout room. And the procedure is the exact same. So 1 minute, the parent remains outside for 1 minute plus 5 seconds. After that, they come back in the room. And sometimes the kid is already like sitting nicely in the timeout chair, which kind of throws parents. They're like, oh, wait. But if they do, that's great. That's one less step the parent has to do. The parent just says, stay here until I say you can get off. If the kid is not in the chair, the parent escorts the child to the chair and says, stay here until I say you can get off. So the swoop and go is a feasible alternative. It is empirically supported. There's not much data on this, but I can tell you anecdotally that I do think that you might have more trials of the child getting off the chair with swoop and go, because think about our population. These are active kiddos. They like to run. If you leave them in a room by themselves, oftentimes they'll be running around in circles. I had one little girl, I was watching a session where they did swoop and go, and she spent the entire time licking the one-way mirror, which she just thought was the funniest thing ever. Great. And so it was kind of entertaining for her, you know. So sometimes it does take longer, but it will work as long as, again, just stay consistent with it, follow through, and it will work. But the other thing with swoop and go, though, is that it's breaking that consistency piece a little bit, because swoop and go is not a feasible alternative for our families. You realistically cannot swoop and go your living room, and you really cannot swoop and go Target. Good luck. We're going to talk about generalizing this to public places in a minute. So it is a little bit inconsistent because what the parent is practicing in the clinic is not what they're practicing at home, which is why we encourage agencies, if you are thinking about PCIT as part of your long-term plan, to really think about the feasibility of a timeout room. Okay, so we have CDI mastery. We've talked about that a lot. We also have PDI mastery for the exact same reason. We don't want parents to just feel like, oh yeah, no, I got this timeout thing. Yeah, I'm pretty good at it. And we don't even want to feel like, oh yeah, I think they're pretty good at it. I watched her one time. She was good. We want to know that they've really got it down, again, at a set level of proficiency. But obviously, it looks a lot different. Right? So when we talk about PDI mastery, again, we're quiet for 5 minutes, and we do code PDI, but we never code PDI in the very beginning. You know, PDI Coach 1, we're not going to code parents in PDI because we don't expect them to have the procedure down. So you wait until a little bit later in PDI. But you code PDI the same way for 5 minutes. But in that 5 minutes, you're only really interested in commands. Of course, you want to make sure the parent goes back and forth between commands and CDI, but you're not coding their CDI skills at that moment, not formally tallying them. You're just waiting for a command, and every time the parent gives a command, you mark that down and you wait to see what happens and see if the parent has appropriate follow-through. And obviously, appropriate follow-through is going to depend on what the kid does, right? So if the kid listens, does the parent give a label praise? If the child doesn't listen within 5 seconds, does the parent give a warning? So what we're looking for PDI mastery is in that 5 minutes that the parent gives at least 4 commands, and that 75% of those are effective commands, meaning they follow all of JP's rules. They're direct, they're positively stated, they're one at a time, all of those rules, and 75% appropriate follow-through from the parent. And that, to us, that's a pretty good marker of consistency. If you could follow through 75% of the time, pretty good marker. So that just goes through those pieces there. Okay. And that, again, is the whole procedure, but we do have what one of my clients very appropriately called PDI Bling. So we are going through PDI, they had learned all the PDI skills, they were doing really well. They're actually thinking about moving, contemplating an out-of-state move. So one of the moms said to me, so how close are we? I said, well, you know, you guys really have all the major steps, but we do have a couple of variations on the PDI procedure, kind of ways to address some of the remaining kind of behavior problems. And she was like, oh, okay, kind of like PDI Bling? And I was like, yeah, exactly like PDI Bling. So we're just going to spend a couple minutes and talk about PDI Bling. So our first piece of bling, our first piece of flair, is a procedure we call house rules. And house rule is a very specific procedure, a little tailoring of the PDI procedure to address those behaviors that really don't respond very well to commands. We really encourage parents to use commands to encourage positive child behavior, but sometimes it's just not appropriate or feasible. And a good example is aggressive behaviors like hitting. So if a child just up and smacks his sister, the behavior's done. You could give him a command to put your hands by your sides, but it doesn't really matter because the damage is done. His sister is now crying in the corner, right? So for those types of behaviors where a running command is not possible, we have house rules. And house rules are really standing commands. They're kind of like always in effect. So we always introduce this later in PDI once the parent and child both are more familiar with the procedure and more comfortable with it. The child is told about the house rule and the behavior is labeled, so we are all clear on what it is. Sometimes that you don't need a long time to label a behavior, like a 6-year-old probably knows what hitting is. But if you have a 3-year-old who does a lot of like pulling of the cat's tail and yanking the cat and throwing the cat, which my brother loved to do when he was an angry teen, then you might have to spend a few more days labeling it. And every time the child does it, say, that was hurting the cat. After Thursday, every time you hurt the cat, you're going to have to sit on the timeout chair. So you spend a little time labeling it just so everybody understands. And then from that point on, after the labeling period, every time the child engages in that behavior, they go straight to the chair. There is no command. There is no warning. It's just straight to timeout. And then from that point on, the procedure runs exactly the same. So they stay on the chair for 3 minutes plus 5 seconds of quiet. If they do get off the chair at that point, they have to go to the timeout room the same way and are returned to the chair in the same way. Everything runs the same. But then, of course, at the end of timeout, there's no command to obey. So the parent just simply walks over to the child and says, you're sitting quietly and timeout is over. So, but just a nice kind of adaptation if there are those aggressive and destructive behaviors where a command doesn't really make sense. I'm just going to finish one more slide here. Public behavior. Timeout ultimately can happen anywhere. Right? And that's the really cool thing and the important piece of that consistency piece and predictability that children will learn, not just to mind their parents in the clinic and at home, but really anywhere where it's happening. And obviously, again, we wait until the parent and child are somewhat more comfortable with PDI before we jump right into this. But the idea is that we can do timeout almost the exact same way in Target, at a restaurant. Obviously, you're not going to have your formal chair, but at that point, again, the child has learned pretty well to stay if they do have to go to the chair. And so we just tell parents, roll up a placemat, put a bath towel. I mean, even a piece of paper could be a timeout chair at this point. And the procedure runs the exact same way as far as the parent still does give a command, give the warning, and if the child disobeys the warning, they go to the chair. Talking with parents about if you are in Target, please don't put your timeout chair in the middle of the toy aisle, right? Kind of thinking about that distraction piece. But oftentimes either the front or the back of the store works out well. And problem-solving backup. Again, oftentimes at this point, kids have learned to stay on the chair, so you're not getting a ton of getting off, but you never know. But again, I kind of think it works out well because out in public, you've got dressing rooms, you've got individual bathroom stalls that are perfect for a timeout room should you need one. But again, you usually don't. I mean, sometimes kids are just so shocked that their parent is actually doing it that they're kind of like, okay, I'll stay. And this is where social pressure can actually work for us because they're like a little bit embarrassed maybe that they have to sit in timeout. So yeah, we talk through parents the same procedure. And if it's not required of PCIT, but if this is a situation that's happening a lot for a parent, maybe they're really stressed by their child's behavior in public or they would really like your support, we will have public behavior outings where the therapist actually accompanies a parent to Target or Walmart and is coaching them in the moment to provide that support if it's necessary. All right. And that is PDI. We want to take a little bit of time for questions. I know it's hard to hold on to some of those really pressing PDI questions. So, yeah.
So I have been on the scene for some really gnarly timeouts in my day.
Yes.
And there are some issues that I was thinking about related to my own experience for like the Hall of Fame 3 standard deviations away from the norm group of kids that I worked with at one point in time. And that's one, do you instruct the parents to wear sneakers? 2, if the child is in the timeout room and they are a danger to self, like constantly striking the wall, biting, pica, I don't even, I mean, just any of the issues that I've seen arise where like with our other protocol, like if the kid was really gonna hurt themselves, we would just kind of hold them. We had physical management protocols, and I know that it's almost like for me, it's harder to unlearn protocol X to learn protocol Y in terms of what the deal is. And so I just wanted to hear you address what is the right thing to do for these kids. And I'm sure you know which kind of kids I'm talking about.
Yes, I do know those kinds of kids we're talking about. So there's two really good questions. One, kind of prepping parent for PDI. Do we have a wardrobe requirement with being comfortable? I don't specifically instruct them, but I do think it's important that the parent feel comfortable. I think Dr. Fernandez had a mom that came in her Pilates gear.
She called it PDI Pilates.
PDI Pilates, because she knew she was probably going to be maybe chasing the kid a little, and preparing them. You know, it's almost like you don't want to freak them out. You never know. And I have stopped trying to predict what my kiddo is going to do, because I think for sure, oh my goodness, I just know this kid's going to go to timeout. It might last a long time, and they're fine. Then it's like the kids, I'm like, oh, she's so sweet. She's so beautiful in CDI. They had this wonderful interaction. I don't even think she's going to go. Bam. Right. There she is, screaming her head off in the chair. So it's a balance of preparing the parent but not, jumping right to the worst. But yeah, just letting them know, having them be comfortable with whatever they need to be comfortable with. The other question is about challenging child behaviors, especially in the timeout room. These are really active kids. They're impulsive. Some of our kids are delayed. What about things like self-stim behaviors in the timeout room? My number one point is to remember that the child that starts PCIT is not the same child that starts PDI. And this is one of the many reasons why CDI is first. So if you have a child who has a history of self-stim, you're going to know about it. And you're going to be working on that from day one. So working with the parents around how to respond to self-stim, of course keeping the child safe, but then really thinking about how can we set up the environment so that we can, if it's possible, to ignore the self-stim. I've had therapists who go and they lay like a really thick blanket on the ground, and then obviously praising the positive opposite, talking about what that sounds like, because oftentimes the positive opposite for a head banging is not immediately apparent to parents, but thank you so much for playing calmly. I really like it when you keep your body safe. I have a child that is right now that is very delayed, and he is mildly on the spectrum. And he had some of those behaviors at the beginning of treatment. He did not have them at the beginning of PDI. So that's just something to keep in mind, that you're kind of picturing the kid that comes and walks in your door for intake and how they ripped apart your playroom and how, and that's not the child that you're going to be starting PDI with. That's the number one thing. Obviously, we are concerned about safety. Our number one concern is child safety. So, but again, these are all things that you know beforehand. So are there ways that we can prep and be prepared? And do we need to pad the timeout room or put gloves on the child or things like that? But then, yeah, talking with the parent about what our protocol will be. And that's going to vary from child to child, but you'll make that plan with the parent beforehand. And again, I think it happens a lot less than you think it's going to.
Okay. And I think it's part of this idea of PCIT is, you have to always be assessing. So assessing the function of the behavior. So I had a timeout this past week, PDI Coach 1, where the parent said, and she had never banged her head at all in treatment, but they said sometimes when we discipline her, she starts to bang her head. And so the question is the function of the behavior a self-stimulating behavior? Is it to get attention? Is it to get out of the timeout? And in fact, and she's 3, she made it to the timeout room and she was screaming. She had taken off all her clothes. She had taken off her diaper. She was not getting out of the timeout room. And she went and she hit her head on the timeout room wall, which we had talked about in advance. Were they ready to sort of follow through? The other parent was behind the mirror with me. And honestly, thankfully in this case, both parents are pretty low anxiety parents, because she banged her head. It was kind of light. She did it on purpose, but nothing happened. So she did it again. and then she did a little bit harder, not threatening, but for another parent, it could have been very, very stressful. And she hit it that third time, and she kind of went like this, and so she stopped doing it. But part of it was trying to understand, if we don't know what the function is, it's hard to know how best to respond. Ultimately, she stopped doing it. I think she did it one more time, a little bit later. We're, again, light, and then no response, so she did it a little bit more, and then she kind of wandered, and she was fine. So I just think it's important for you also, again, this is where you're confident as the therapist, that you have a plan, that you're trying to, it doesn't mean you automatically jump in to stop it, but it also doesn't mean you wait and allow it if it doesn't make clinical sense.
Yeah.
There's a lot of flexibility of what to do, it seems.
Yes, it's like Kendall, right? Flexibility with infidelity.
Mm-hmm.
Yes.
I had a question regarding the timeout, like out in the community when you're trying to implement it.
Yes.
I can just picture a scenario where you're in a restaurant and you have this kid that's having a full-blown tantrum and you have all the parents looking at you. You have them sitting in timeout, but how do you work that out? Because obviously it's disruptive to the people around you.
Yes. Yes. That hits a really important question about doing timeout in public. Obviously can bring up a lot of emotions for the parent, feeling like people are going to be looking at me, he could be screaming, what are they going to think about me? So that's actually something I kind of breeze through public behavior. That's something that you talk about with parents. How do you feel about doing this in public? Do you feel comfortable? And talking through their feelings about it, that's where some of just kind of basic CBT is helpful. So if you were a parent in this situation and you saw another parent going through this, what would you think? And most parents are actually able to admit that, yeah, I'd feel for them. And I'd appreciate that at least they were trying to do something about their kid rather than let their kid run around and stick his hand in my soup, you know? Because that's what those kids were doing before. So, I think it's important to process that. And also kind of similar to what I was saying with Annie's question, also remember that that is why, though, that we don't do public behavior right away. So again, the chances, once you're at PDI, later in PDI, and you're actually doing public behavior with a family, the child has learned the procedure, they know their parent means business, and if they do have to go to timeout, chances are they're pretty calm about it. But it's important to prepare the parent and talk through it, yeah.
And also, one of the things we do in public behavior is we coach the parent to look for appropriate timeout spots in public. And so, for example, if you're in the grocery store or supermarket, I believe some folks call it, but if you're in the grocery store, you don't do a timeout in the checkout line. You take the child outside to the bench. If you're in a restaurant, you don't plop the child into timeout in the middle of the restaurant. You perhaps take them to the restroom, or you take them, in Miami, it's great. You take them outside and have them sit on the bench. But you try to move them away from as many people as possible during that timeout procedure, and as out of the way of the places you can.
And sometimes families, I know in our experience, and likely, in some of the cases that you work with, parents are very concerned about other onlookers, and not just the social pressure, which is a huge part of it, but also if they have to put their hands on their child, and if there's been any concerns of ACS involvement or DCS involvement. So there are times where we have provided letters saying like they're part of this program, they've been instructed to do this particular approach, so that they can, if they were questioned in any way, they have that information.
Yes.
Do you make sure that parents are aware that if they're going to issue a command, especially at the beginning when the child is learning this, that they have the appropriate time to follow through if they need to?
Wow, good question. Absolutely. We talk about that a lot, yes. So John Paul and I both kind of mentioned that the generalization of PDI from clinic to home is very gradual. And it's different from CDI in that way. I mean, CDI, you heard me yesterday, CDI teach, I'm like, go ahead, do it. I want you to try to practice every day. Let's talk about how it's going to happen. PDI is different, and you can see why, right? You can do CDI at different levels of skill, but it's not like you can kind of do it incorrectly. You're spending time with your kid, that's great. PDI is very different. So we work with the parents on very slowly generalizing. And in the beginning, we start out with very basic play commands within the context of special time. And say to parents, you know, we really want you to go slow here. And then when we move to more real life commands, we specifically say, let's talk about some times that would be good for you to give commands and the types of commands you're going to give. And let's talk about some times that maybe aren't so good. Because you can see where parents are very tempted. What's the first thing they want? They want, you know, well, when we're getting ready for school, I cannot get him to put his shoes on. Which could be eventually, that'll be a great time to use PDI, but that's probably not the place to start when we've got to get out the door. Right? So talking that through so that parents are, we're sure parents have the time to follow through. Yeah, very good question.
Yeah, I think we have time for one more question before we move on.
Any other PDI questions? Yeah.
I have a question, but I'm kind of trying to form it in my head. I know that we do various like social skills groups for kids here at the center, and I know with certain timeout, we call it like timeout loops, like you kind of want to pick and choose your battle. So can you give me an example of what command, like a non-compliance command that's something that's starting out at the PDI session, and then like what a more experienced parent would use the timeout for?
Yes.
Do you know what I mean?
Yeah, I do. It's a really good question. You guys are so good. Yes, absolutely I do. So John Paul, actually, this gets back to what the last, do you guys remember what the last rule of effective commands were? There was that drill sergeant on his slide. Only when necessary, right? And that's ultimately what we do want. That we don't want drill sergeants, and we really want to be thinking about with our parents when you really need her to do something, and that's when you use PDI. We do break that rule a little bit early in PDI because we need to start slow, and we need to start with what we call practice or play commands. So in the very beginning, and you guys probably will see this, PDI Coach 1, I'm going to start very simple. And I'm going to actually coach the parent to say, hand me the red block. That's going to be our first command, something like that. It doesn't have to be hand me the red block. Something very simple. We do that for several reasons. One, we need the parent to get used to it and practice with something simple. We need the kid to get used to it. We can't start with hold my hand before we cross the street. The stakes are too high, right? So we start out slow to give everybody a chance to practice. It's also very likely, most kids, some kids don't, we've had them too, it's also very likely that the kid will comply with that. So we're setting the kid up for success. And we're making the parent feel like, okay, I can do it, you know, he's listening. So in the beginning, we kind of violate that rule a little bit and we do these play commands. As we progress through PDI, it is going to become, the commands are going to become more and more realistic. And so you think about, it depends on what the kid does a lot of times, but some good realistic commands, if the child is, you know, jumping on the table in the special time room, in playroom, put your bottom on the chair. Very real. Cleanup commands, more realistic, sometimes really challenging for little guys. They don't want to clean up the toys. As we progress through PDI, we're going to be doing more and more cleanup situations. Transitions can be really helpful. Helping the parent. Coaching, again, remember what I said yesterday, coaching does not stop just because you leave the observation room. So you're going to have a lot of good practice as you progress through PDI with real life commands as the family transitions in and out of your treatment space. You open the door to the, we have like, you know, a locked door to get back to our clinic rooms from the waiting room, and, you know, my kiddo just the other week ran down the hall because he was excited about special time, but Coach Mom, I looked at Mom, she's been with me for a while, I looked at Mom, she said, hold my hand. Right, good. Rather than stop running, which is what, you know, a lot of parents will say, very understandably, hold my hand. So thinking about positive opposite commands. So you're going to move towards those types of commands as you go through PDI. And eventually, we don't want parents to be using PDI for things like hand me the red block. That's not the goal. And that's one of the reasons why I talked earlier about really praising the compliance piece when you give that label praise, because that's what we're shaping. In the beginning, do I really care about the red block? No. But I do care that he learns to listen, and we need to do it in a very simple, controlled way. So that can help parents rather than saying, thank you for the red block is a fine label praise, but we really want to encourage, thank you so much for listening. Because I don't really care about the red block as much as I care about the listening. Does that answer your question?
Yes.